Dear boy, as a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi, pediatric pulmonologist, tomorrow at 3 p.m. as we discuss common cold and cough in children. Join us on our socials, Korle Teaching Hospital, on YouTube and on Facebook. See you soon. Hello everyone, I'm Dr. Hilda Mantibia Boy. As a pediatrician in our clinics and in our OPDs, we tend to see many children coming in with coughs and colds. Do you need to give an antibiotic every time your child has a cold? What do you need to do? Is it viral? Is it bacterial? Join me and Dr. Sarah Mwadwi.
Hello everyone. A warm welcome to the July edition of the Korle Teaching Hospital monthly webinars. My name is Dr. Hilda Mantibia Boy. I'll be moderating this session, and I'm so glad that you have joined us on YouTube and on Facebook or wherever you have joined us from. Thank you very much. So today we are discussing common cold and cough. We know that it is very common and many of you may have questions or concerns about it. And to delve into this discussion, we have a pediatric pulmonologist, and she's in the person of Dr. Seyram Wadwi. We are so glad to have her. She's the best person to do this job right here in the Korle Teaching Hospital. So, Dr. Wadwi, you are warmly welcome. Dr. Wadwi, just before you delve into your presentation, who is a pediatric pulmonologist? And maybe tell us a little bit about yourself.
Hello. Thank you to everyone who has joined us, and a good afternoon to you all. A pulmonologist is someone whose main work focuses on the lungs and the airways. So when we add pediatric, it means that I work with children's lung and airways. So basically, everything in your chest except the heart. That is what a pulmonologist does. So this afternoon, we are talking about common cold and cough among children. It's a very, very important topic because it's very common. It's in all our homes and with ourselves as well. What I'm hoping that we learn at the end of this session is that each of us will be able to list 4 causes of the common cold in children, to state 5 symptoms. When you have a cold, what shows you have a cold? And then some colds require further work, be it testing or examining the child. So those present with red flags to help us identify the red flags that require further evaluation. And for each of us to state the recommended treatments for common cold, because there's so much information out there about what is recommended and what is not, especially as we are dealing with children. So this is a very familiar story. A 3-year-old boy comes to the outpatient department with a runny nose for 3 days. Nose is congested, he's coughing mildly, he has a low-grade temperature. He's eating a little less, but he's drinking well. And the mother requests from the doctor antibiotics because the mucus is now green. Every health worker, be you a nurse, doctor, lab person, you have seen this situation before. And for the mothers, even if you haven't voiced it out, you have wondered whether your child doesn't need antibiotics. So these are questions that we'll keep in our mind as we go on. What is the most likely diagnosis for this child? Are antibiotics necessary? If you were the doctor or nurse or caregiver, health caregiver, what advice would you give to the home caregiver? That's the parents. And when would you say that the child should come back to the hospital for a review? So there's a reason it's called common cold. It's so common that everybody has had something to say about it. The grandmothers, everybody has had something to say about it. In 1931, someone said it's so common that we are apt to pass it by with a contemptuous gesture unless we are the sufferers ourselves. In the same era, somebody said if you want to prevent it, you have to be protected against cold. You make sure that you sweat very well by moving to a hot and dry climate. And we know if that were true, nobody in Ghana would ever get common cold. And he said that these are the measures that we can do to prevent catarrh. Very recently, one of our celebrities also had something to say about it. She said that parents, when your children have a cold, use shea butter, palm kernel oil, or coconut oil in their noses, and they will be fine. And this was carried in mainstream media. So now, what is common cold? It's an infection of the upper respiratory tract. So that's the nose, the throat, and the sinuses. And it's not an infection that lasts long. It's usually caused by the germs that we call viruses. If you don't know what a virus is, you can think about COVID-19. When COVID came, everybody said it's a virus, so we don't use antibiotics. You cure it yourself. You get exposed, you will not get a sickness, or you will not fall sick. So that's what a virus is. Common cold is the most common childhood illness. And children do get a lot of common colds. Children less than 5 years will have about 6 to 8 episodes a year. Going to daycare puts you at greater risk of getting a common cold. So if you have a child in daycare, they may have up to 10 to 12 episodes a year. And there are 12 months in a year, which means that every single month, your toddler in daycare may have a cold. And that is probably totally normal. There's nothing to panic with regards to that. And it's more common when the weather is cold. It's not very well understood why that happens. It causes parents to not go to work, children to not go to school, and it keeps doctors and nurses and PAs busy in the consulting room. So these germs called viruses, there are many, and more than 200 of them cause the common cold. And if you take 100 children who have the common cold, only about 5 of them have a bacterial infection. And even in that case, some of them are an infection with bacteria and viruses together. So that's a bacterial co-infection. That means that most of the time, if you assume that all colds are caused by viruses, you are probably right. Bacteria have very little to do with this disease. How do we get common cold? Anything coming from the respiratory tract that contains the virus can transmit common cold. So as I'm talking now, if I sneeze, I may transmit common cold if I have it. You may come into direct contact with the viruses themselves. So I sneeze on you and it lands on your nose. Or I sneeze on a surface and then somehow your nose comes into contact with that surface. Or my hands pick it and I bring it to my face. That's the way in which we get common cold. So you can see why it is very common among children who go to creche or kindergarten or nursery, because they interact so much. Something drops from someone's mouth, the next person takes it and puts in their mouth. They come and hug one another. Somebody uses a handkerchief, puts it down. The friend, because sharing is caring, will come and take the same handkerchief. What happens when you now get exposed to the virus? it will take you about 1 to 3 days if you are going to develop a cold to get it from the time you are exposed. So that's very short. So one person in the class gets it. By tomorrow, more people get it. By the third day, half the class has a cold. So just to explain how we move from getting in contact with the virus to when we develop the symptoms that we develop. The effects are in the nose. They are not, everything happens in the nose. So we release some things into our blood vessels from there, and those are the things that cause sneezing, running nose, our nose gets blocked, we cough a little, we have sore throat. And especially for the younger ones, they may also have symptoms further away from the nose. So fever, muscle ache, pains, headache, tiredness, mood changes. They don't want to play. They say that their muscle is paining them. Sometimes they won't say, they will just be quiet. For healthcare workers, we look for signs. Usually for common cold, there is no sign. So when you see a sign, that tells you you need to beware. This is probably not common cold. In my experience, a lot of mothers may come when their children have common cold and say that their children are wheezing. But in actual fact, it is because the word wheeze is used very loosely in the population. People refer to many things as a wheeze. So sometimes the child's nose is blocked, and then when they breathe, you hear a sound, and then people call that a wheeze. But usually, if you unblock the nose, then you see that that sound doesn't come again. So for common cold, usually there are no signs. So how do the symptoms go? The first 1 to 3 days, the child will sneeze, there will be running nose, but the water that comes out is clear. There is no color to it, and they may be a little hot. Then from the 3rd day to the 5th day, the clear running nose now becomes thick, and the mucus may be green, and they may cough a little more. By day 5 to 10, they get better. They start getting better slowly, and they get better. Now, when the mucus is green, it has nothing to do with whether it is bacteria or not. And we know this infection, but it has nothing to do with bacteria. So for us in the clinic, we listen to the story and we make a diagnosis. Tests are not required. If the story sounds like common cold, tests are not required. We will only need to do tests if the child is very sick, if we suspect that, well, it started as a common cold, but now it has become something else. Or if we suspect this is not a common cold. Otherwise, no investigation is required. Now, there are some things that look like common cold, but they are not. So when the toddlers are having colds like that, a lot of parents will think that they have allergies. The thing about allergies is that usually the parents can identify a trigger, because allergies can cause the nose to run. But usually the parents can say that when there is a scent, then my child sneezes or something is burning. Inflammation of the sinuses, there are air spaces in the head, and for children those air spaces are not well developed, so for that reason sinusitis is quite rare. Then there is something that is called strep sore throat or streptococcal pharyngitis that needs to be treated, but for that one usually a cold is not the prominent thing. What they have is just a sore throat. The throat is just sore. And then of course I'm sure we've all heard of pneumonia, which is an infection of the lungs. as against common cold, which is more of the nose and the throat. And then pertussis, whooping cough, also called the 100-day cough, because the child coughs for a very, very long time. And the thing about the whooping cough is that it comes in, let's say, batches. So the child can cough repeatedly for, say, 45 seconds or a minute, and then they take in a breath. So it's like, after they've coughed that long. So that's characteristic. Then some children may put something in their nose, and because of that, their nose is running. You find that discharge is usually smelly, and often it's just one nose. And then asthma. And then there are some children that the hairs in our nose and in our throats that help us to clear the dirt and so on. They are born with those hairs, or the hair is there, but instead of beating forward, it beats backwards, or the hair is just beaten in a very disorderly manner. That's primary ciliary dyskinesia. But again, what you find is that whereas a toddler will have maybe a lot of colds when they are in school, when they are on vacation, they are better. In PCD, they always have a cold every day, 30 days a month, they have a cold. When is it not a common cold? When your child is struggling to breathe, the temperature is very high, not coming down. Your child is not eating anything at all. It's very weak. You see that the lips and the tongue are blue. Your child is breathing and you hear sounds when the nose is not blocked. If your child's symptoms have lasted more than 2 days, 2 weeks without improvement, or if your child tends to have severe infections, every time pneumonia they admit, or something small cuts the toe, then it becomes a bone infection, those sort of things. And if you have immunodeficiency, the one we know, most of us know, is AIDS, HIV, but children are also born with immunodeficiency, which means that their immune systems don't work well, and it is not HIV or AIDS. So if those things are happening, then this is not common cold. Now, I talk about it like, you get the infection, it resolves, but rarely it may progress and lead to a complication. May have ear infections. Sinusitis, not typical for childhood, so the adolescents and upwards. Pneumonia. Some children may wheeze. Some children who have asthma already may have manifestation of their asthma. And then the younger children, the infants, and say 1 year, 2 years, they may have what we call bronchiolitis, which is like asthma, because they also wheeze. Now, how do we treat it? I think that's the main aim. What do you do for your child? So when we say treatment is supportive, we mean that do whatever can just make your child happy or feel good while the disease takes its course. So for common cold, the treatment is supportive. What do you need to do to relieve the symptoms? So if the child is a little hot, you may give paracetamol according to the child's weight, because para is always according to the weight. If the child has lost appetite, you make sure that at least they drink, so that the water in their body doesn't go low, they don't get dehydrated. So they don't need to drink big amounts, even if it's 10 ml every 10 minutes, 20 minutes, that sort of thing. You just make them comfortable. If you have to carry them, if you have to lay them in bed, and then the doctor or nurse or PA or whoever has to educate the caregiver, because if we don't educate them, then they go looking for solutions elsewhere, when actually there isn't a better solution elsewhere. So when I say prevent complications, I mean things like, when children, a certain age, when they are very hot, they can get a convulsion from the fever. If they are not drinking, they can get dehydrated. So that's what it means to prevent complications. Now, this slide, it's really based on what your ambition for coming here today is. Now, if you're a doctor, the evidence is that the many medications that we tend to use for common cold, they don't help. They don't do anything, because these have really been studied. Antibiotics, there are cough syrups that contain carbocysteine. We all know, I don't want to mention a brand, but cough syrups that have diphenhydramine, antihistamine, spiritin, cetirizine, some things we put in the nose, the decongestants, some things that stop people from coughing, cough suppressants. The evidence is clear that they are no more effective than placebo. So placebo is like giving something that does not contain a drug to someone just to make them feel that they are taking something. So it can even be water that you package in a way that looks like the medication. And when you really study these things, they are not more effective than placebo. So the thing about therapies that don't actually work, but we think they work, is that when the disease resolves on its own, let's say you give your child a cough syrup and your child gets better, it's not necessarily the cough syrup. But in children, what worries us is that there is no medication without side effects. So all these things that we give them do have side effects, including the antibiotics. They do have side effects. However, looking at it being a disease that would resolve on its own, if you just make your child comfortable, you make sure your child is not too hot, is drinking something, your child will still get well. So for me, it makes better sense to keep that money in your pocket for other things, because the medicines, they don't work, but you are just exposing your children to cough syrups. And the thing is that your child will get well anyway. So you just need to hold on a little bit, make your child comfortable, and then the disease runs its course. So vitamin C, so that's not studied in children. Vitamin C that people tend to give. The study that was done in adults. And it's even been found that a group was given vitamin C, a group was given placebo, but the placebo wasn't covered well. So those who took it knew that they were taking placebo. And if you're in a study where you know you are taking nothing compared to those who took something, those who took something tend to say they are better. Those who took nothing tend to say that they were not better. So that study was not even of very good quality. And then it wasn't even done in children. So there's no evidence that says that vitamin C works. So what if we say those things don't work? What actually works? So it's very useful because along the way, the mucus gets really thick. So saline is just salt water. You can even make it in your kitchen. Or we all know saline nose drops. It's very useful to put in saline nose drops because it makes the discharge, what is coming from the nose, thin. And when it's thin, then it can easily be brought out and the child feels better. So that's very useful. And then any medicine that reduces the temperature or that relieves pain. So paracetamol, very, very, very useful. Brufen may also be used, but Brufen, I think when you look at the side effects profile, paracetamol is much better than Brufen, but Brufen may also be used. There is some limited evidence that honey works for a child who is more than one. Very important not to give it to children less than one. Even that evidence is contested. They said it was sponsored by the Honey Board, which is a group of people who manufacture honey, deal in honey, sort of that sort of thing. But a lot of people report that it soothes their throat. So if your child is less than one, maybe a teaspoon of honey at bedtime may help. And then warm fluids. When the fluid is warm, the children tend to accept it better. So vitamin C, zinc, pyritin, cetirizine, herbal remedies, they are all not recommended because evidence from large studies all over the world does not support it. So avoid these things that are not beneficial. The first is oil. Okay, oil. For me, as someone who works in the lungs, oil is very important to me because you see, the oil, depending on what oil and how much and whether the child is fighting you when you give it, that child can actually breathe the oil into the airway and it goes into the lungs. Our lungs were not made by God to be covered by oil. So depending on the quantity that goes in, your child may end up in hospital on oxygen. A lot of things we do in our homes and get away with it, but the day your hometown people are on duty, it will not end well. So please avoid oil. This disease will resolve on its own. Our grandmothers used to melt shea butter and put in our nostrils. I don't know whether maybe they had more patience than us. But today's children, you hold them, you hold their mouth, you put oil, they take all the oil into the lungs. You will end up, or you may end up on oxygen in hospital, and it's not a good place to be. Antibiotics, no. All the drops that we put in the child's nose, which is not saline, no. Cough suppressants. God created cough for a reason. When we cough, we bring out all the dead things, polluted things that we are breathing into our airway. We bring those things out of our lungs. So God created cough. It has a very important thing to do in our airways. So if you're a nurse, for instance, you know that when people are in coma, they don't cough. And the reason we don't feed those people and we lay them on their left side is because they can't cough, anything can go into their airways, you see. So for those of us who are not in coma, the way we protect our airways is through cough. You are eating some rice passes the wrong way, you cough it, so it doesn't choke you. So please, cough is not to be suppressed. It's better we find what is causing the cough and then we address that problem rather than just stopping the cough. All sorts of combination cold medicines, aspirin, they are not beneficial. Let's avoid them. Now, I already said antibiotics don't treat viral infection. And antibiotics, bacterial infections can be very severe. So we need to protect our antibiotics. That's what is called antibiotic stewardship. So if we don't protect the antibiotics, we give it every common cold, we give antibiotics. Apart from the side effects, diarrhea, allergic reactions, and so on, the antibiotics become weak with time. It's like when we were young, we used to treat malaria with chloroquine. Chloroquine nowadays will cost probably 10 cedis in today's Ghana. But now if you have malaria, you are spending close to 100 cedis because chloroquine the medicine doesn't work. So if we don't protect our antibiotics, the same thing will happen. You only give antibiotics if there is evidence of bacterial infection. And for that, you need to go to hospital and let the doctor tell you that they suspect this is a bacterial infection. So to you, the parents and the healthcare worker, what do you tell the parents? You need to tell them that this disease will, maybe by 10 days, by a week to 10 days, the child will get better. The temperature will last 2 to 3 days and go away. Cough may linger a little bit more. They may cough up to 3 weeks, but by the 3rd week, you see that you listen the whole day, you hear 1 or 2 coughs. Green mucus is normal. It doesn't mean that now antibiotics are needed. Antibiotics are unnecessary. When should you worry or take your child back? If the temperature has lasted more than 2 to 3 days, and if the temperature is really, really high, if your child is vomiting everything, refusing everything, is weak, the lips have turned blue, those ones, they are warning signs. They require that you go back to the hospital. How do we prevent common cold? Hand hygiene. In COVID time, when we were all washing our hands, people weren't getting colds. And at that time, the toddlers were at home. They weren't getting colds. Coughing, you cough into your elbow. You don't cough into the handkerchief that you are holding with your hands. Then you come and hold this. For the adults, the reason to avoid tobacco smoke is for yourself and for your child. Once you smoke at home, your child is also smoking. It's called secondhand smoke. And because it affects the way the nose and the throat passages work. It makes people who get in contact with viruses get cold faster. Breastfeeding. We should all love breastfeeding, including the men. Because when you breastfeed your baby, you are not only giving food, you are giving food plus medicine. There are a lot of things in breast milk that fight against viruses. And this disease we are talking about is caused by viruses. And then the immunizations that we give, our children should go for weighing. Our children should eat well. So eat well, usually eat well means the food should be prepared at home, usually. The thing is that the biscuits, the drinks, and so on, if we make those things, and then the fried things at the roadside and so on, those are for occasional. But to get adequate nutrition, our traditional foods are really good. Because if you look at kenke, pepper, and fish, you know, some tomatoes is in there, some pepper is in there. Or if you look at yam and kontomire stew, those foods tend to be almost balanced. Even if they are not balanced, if you add some fruits, then you are good to go. So the reason we pray everywhere is that Jesus is everywhere. We also have to wash our hands. Germs are everywhere. So by now, everybody knows that the case that I started with is common cold. Management is supportive. You just need some saline, some drinks, water, cocoa, soups, those sort of things, some medicines to bring the temperature down like paracetamol, and the mom needs advice what to do, when not to do. I will summarize by saying that common cold almost all the time is caused by viruses. We don't test for it. We don't need antibiotics. By 10 days, most children will recover. Just keeping the child, happy and calm is okay. And that's for us health workers. When we counsel them properly, then it reduces antibiotic use, and then the children, because they know what to do for their children, it improves the outcome. But if we don't, they'll leave your consulting room and go elsewhere, and that person may probably give them what they want. Okay, thank you very much.
Thank you so much, Dr. Sarah Mwadui. If you're watching, I'm sure you have enjoyed the delivery or the presentation that she has done on common cold and cough. Now we have some questions in the chat box. If you haven't sent yours yet, you can send it in the chat box on the YouTube Korle Teaching Hospital or on Facebook Korle Teaching Hospital, and we'll read them and have her respond. The first question is: using shea butter with rub and other traditional relievers for the child's chest therefore not necessary?
Treating common cold is not necessary. It doesn't really depend on whether the therapy is got from the herbalist or is got from the medical doctor. It's usually not necessary. Now, the problem with oil, shea butter, anointing oil, olive oil, any oil, the problem with the oil is that, as I explained, it can go into the lungs and cause problems. It depends on the quantity though. That's why most people get away with it. But if the child isn't calm, the child may take all that you put into the lungs. So it's not necessary. I would rather you do something safe, and that is saline nose drops. Menthol rub may offer some relief, but for small children, especially the babies, they take it into the bloodstream, and then that exposes them to side effects. So I would rather you do something safe, which is saline in the nose. Otherwise, yeah.
Thank you. We have another question here. My son suffers serious allergy of his eyes. His eyes will be red. His nose is always blocked, sneezing and headaches all the time. She says, So it's a big bother to her. Help her, please.
You need to see a doctor. The reason I say so is that when you sit with a doctor and have that interaction, then they take a history, they take more information from you that will help to pinpoint the things that the child is probably allergic to. And also, I'm not exactly saying you are wrong, but the doctor also has that chance to agree with you that it's an allergy. Then you can agree how to move forward and manage it. So you need to see a doctor.
All right, there's another question here. She says, my baby started coughing when he was 2 weeks. After seeing the pediatrician, I was told it was a viral infection and was given an antibiotic. The cough has come down. Now I will say,
I mean, the who is because if you don't even treat it, if it's a viral infection, it will go away anyway. So, like we said, we need to protect our antibiotic. That's the main thing. And the money that you spend on antibiotic too, you can use it to buy some water for us to drink.
Now, someone wants to know, what of saline nebulization? Does it help?
The principle of putting saline in the nose to make the mucus in the nose thin. That same principle may apply to the airways. And so saline nebulization may help. But these are procedures that we would rather a doctor advise you to do. You may not need to spend your money going to buy a nebulizer or have to have your child admitted in hospital or detained to nebulize the child. So again, I prefer that we just stick to what is recommended. However, if you take your child to hospital because of certain concerns and the doctor recommends nebulization, that usually is done when the child can't breathe or they find that there are sounds coming from the chest. You see, so it's really difficult to sit here and say so. But the recommended is saline nose drops, or at best, saline spray in the nose.
My son has common cold and cough. We are in the second week. It's still around. Last week, Friday, his temperature was high and I took him to the clinic close by. The nurse ran a malaria test and it was negative. In the end, she gave vitamin C syrup and an anti-malarial as well as an antibiotic. I asked her about the malaria since it's negative. She said, oh, it's showing negative, but we have to treat it. I gave it for 3 days. He has no fever. The mucus is yellow and light. The cough has reduced. I used saline drops, but now he is not eating much or drinking much. And that is her worry.
Like we said, common cold by day 10, 2 weeks, your child's nose, the discharge from the nose should have gone away, although the cough may linger a bit. So if your child's nose discharge is lasting 3 weeks, did you say?
About 2 weeks.
Okay, about 2 weeks. But if your child is not, getting better, then that child needs to go to hospital. And the other thing that is of worry to me is usually for common cold, the temperature comes at the beginning. It doesn't come in the middle and so on. It's possible for a child to have a common cold and then along the way, something else comes in. So I would say that if your child doesn't continue to get better, if eating and drinking is a problem, you need to go back to the hospital.
My child has sickle cell disease. She mostly has a runny nose, runny eyes, and mild temperature. So I guess that's like a fever, mild. But no wheezing and breathing is fine. Please, is it common cold?
If your child has a cold and most of the time, or you see that the pattern is that with the cold, the eyes are also runny, that's usually not common cold. And one of the things that we need to be careful of is people who have other diseases. So for instance, that your child has sickle cell disease. We know that in sickle cell disease, they may not be able to fight infections really well. So when your child is showing things that are not exactly like common cold, it's better you see the doctor. Although this still may not warrant antibiotics because you said the eyes run at the same time. So is it some allergies, but it's a doctor who has to make that diagnosis.
Someone else's concern is that my child snores like an adult.
So snoring, we have to do something about. So you need to go back and see the doctor. No child should snore. Adults, yeah, but usually when children are snoring, what happens is that when they go to bed, the fact that they are snoring means that their airway is not very free. They are not getting enough air. And some of them, they will snore in their sleep, wake up. When they wake up, their airways open a bit more. They take in air, oxygen goes up. Then they go back to sleep and they keep snoring. The oxygen gets low. Their body wakes them because the oxygen. So they do that thing throughout the night. So they don't sleep well. So when they go to school, they are tired. And when they are tired, they either fall asleep or they disturb everybody and the teacher has to beat them and label them stubborn children and then they don't do well. So snoring for children, it must be attended to.
Another person says, thank you, Dr. Serum. But we continue with the questions. My son is 5 weeks and has difficulty in breathing. Also, it looks like he has a buildup of phlegms around his chest. What is this about?
I pause because when people say phlegm, it's just like when people say wheeze. You really need to understand what the person is saying. So to the one who sends the question, we really need to understand what you mean when you say phlegm. Sometimes it's because the child is breathing noisily. Then people call it phlegm. The child is breathing really fast. They call it phlegm. And then actual mucus is coming. They call it phlegm. The child eats, vomits, and because there's some mucoid thing inside, they call it phlegm. So we really need to understand what phlegm means before we can help.
Great presentation. Did I hear vitamin C is not good? I have a 9-month-old baby and I gave her vitamin C. I've been giving her vitamin C daily since she is in school. Please, should I continue?
So it is not that vitamin C is not good. We all need vitamin C. The amount of vitamin C a child needs is an orange a day, or other fruits that have a lot of vitamin C. Apple, so they say an apple a day keeps the doctor away, so that you have enough vitamin C in your body. Now, the body doesn't store vitamin C. So when you give extra, we urinate it out. What I did say is that vitamin C is not an effective treatment for common cold. So if your aim of giving the vitamin C is to prevent a cold, I'm sure if I engage that person further, the person will tell me that the child is still getting colds despite getting the vitamin C. So because it is not necessary, and then we would rather you eat the food because everybody should eat a balanced diet. I suggest, if you don't mind, that you use the vitamin C money to stock fruits in your home. You can squeeze an orange for your child, and then that's better.
Why should my child under 1 year not take honey?
There is a disease that is called botulism. The process of making the honey leaves some spores in the honey. And for some reasons, the children under 1 are more susceptible to botulism than the older children. And so because of that risk is why they should not take honey. In fact, there are even authorities who stretch that 1 year to 2 years. They will tell you that until your child is 2, you should not give honey.
My 4-month-old son has cold and cough for almost 3 weeks now. It's not resolving, and you can hear a sound when he's breathing or sleeping. You can also hear that there are phlegms built up in the chest, but doesn't come out. What do I do?
Yeah, so again, a common cold, 10 days, as we say, pata pata. By 14, your child should be free. So if it has lasted 3 weeks, you need to see a doctor.
Okay, there are a number of questions, but some of them are similar to those that we have answered already. So let me see, there's another one. Is the use of crystal pearls good for children? Yeah, somebody's also asking autism. No, I don't think we mentioned anything on.
No, I think when I was answering the honey question now, I
botulism.
said, yes,
Okay.
I said children, the under ones may get botulism.
Okay. No, they wrote. Okay, all right, yes. Let's see. Is it possible that a viral infection can coexist with a bacterial infection? I think you mentioned that.
Yes, so that's possible. If it is common cold, it is really, really, really rare. What is more common is that the common cold does not resolve. So 3 weeks, it's ongoing. Then you know that something else is happening.
My child had cough and mucus come from her nose and ear. Is this okay? My son had cough and mucus comes from her nose and ear. Is this okay?
No, it is not okay. When mucus coming from the ear, we always take that one very seriously. So that is not okay. You need to see a doctor.
What about the case where the child coughs to an extent of vomiting or passing gas or stool, yet he or she doesn't run temperature? In that case, but this irritating cough also prevents sleep, what do you do?
The first thing to understand is whether it is just a cough or a cough and cold, because there are some diseases that present like that. It's just a cough. They cough so badly. Yes, I mentioned whooping cough. Asthma may present like that, but these ones would typically not have a cold the way we have described. So the first thing to understand is whether this is happening together with a cold or it's just a cough, and then we can help the person.
Whenever my daughter gets cold, then cough follows up. She had croup when she was 2 years old. So anytime she gets cold, then the croup follows. Please help.
One of the first things that we learn when we are specializing is that croup rarely recurs. So this child needs to be properly assessed. You can't get a croup and keep getting a croup and keep getting a croup. So this child needs to be properly assessed.
My son has common cold and cough for 2 weeks, but his temperature is okay. What do I do?
You just wait it out. Like we said, 2 weeks should be the end of it. But if it progresses, then you need to take your child to the hospital.
Okay. So we will now take some questions from the audience. If you're just joining us, you're watching the webinar series of the Korle Teaching Hospital, and today we're discussing common cold and cough. Thank you for joining us. We'll take some questions from the audience in person.
Okay, thank you. My name is Derek. Okay, so doctor, I wanted to ask a question which I have observed for some time now, and it has been a concern. Okay, so that is with children that have a runny nose. Okay, most of the times I see parents do this, and I just wanted to ask if it's the right thing to do. So that is when their children, their nose are running. Okay, what they normally do is that they put their mouth on their nose and suck the mucus into their mouth and throw it away. And from what we've studied, I realized that some of these mucuses are coming out because of infection. Okay, so is it right or is it recommended?
So this question, we really need to do a cost-benefit analysis. Now, when you put your mouth on your child's nose and you suck it, it is very effective sucking, and it clears the nose, although it's temporary, till another build-up comes. If you don't do that, your child's nose is blocked, and then they don't eat well because they can't smell the food, their appetite is gone, they are miserable, The alternative is to buy something from the pharmacy or wherever, a small suction. There are various kinds of suction that you can buy and put in the child's nose. Practically, by the time they become toddlers, they don't allow you to insert anything into their nose. When you want, they just run away. But they would allow you to do the traditional suction that you've described. The problem with what you have described is that based on the transmission we talked about, the adult who is doing that will or is at risk of getting the infection. But the reason I say we need to do a cost-benefit analysis is that we know that by adulthood, adults they are less at risk of cough and cold. So if a child is going to get 10 a year, the adult is probably going to get maybe 2 or 1 or 3 a year, you see. So there are some of these episodes that the child will not get a cold for. The important thing is to try and have a way of unblocking the child's nose. Saline does that very well. If you can just put saline in the child's nose, even if you didn't suck it, it just runs down and you clean it because it's so watery. So if saline works well, why would you want to put your mouth on the child's nose and suck? But if you do put your mouth on the child's nose and suck, you will clear the nose. You are at risk of getting a cold. We have to look at whether it's really, but it is very effective suction. The problem is that you may get a cold. You may also get away with it because you're an adult.
Any others from the audience?
I know doctor has already said that when they have the cold, the nose is running, and then when they are breathing, you feel something like this. We are saying it's mucus that's on the chest, because you can actually hear it when they are trying to breathe. So when you hear it like that, he's not running temperature, he's eating okay, but the nose is running. What do you do? Do you also do the saline? Okay.
Just put saline in the nose and then it runs down. Or if you have something to suction it. If it's a child who can blow the nose, you encourage them to gently blow the nose so that they unblock the nose and then they can breathe better.
I know our grandmothers would also add a bit of garlic and shea butter and use it for the chest and then the lungs. But you're saying we shouldn't do that.
Well, if you are rubbing shea butter on the child's chest, right, it is much different from putting shea butter in the child's nose. Yeah, because we know that shea butter is a lubricant for our skin, and it keeps the skin well oiled and so on. And the action of rubbing may also be some form of traditional chest physiotherapy, which may have some advantage. I have seen a study before where chest physiotherapy was studied in common cold and so on. It's not a great advantage, but apart from the fact that you are spending your time, it doesn't put the child at risk. But the putting in the nose, that is where the problem is.
Any more?
Yes, please. Thank you very much for this wonderful presentation. I've really learned a lot from this webinar. My question is, how does the environment worsen common cold in children? The environment, how does it worsen common cold in children?
So, common cold itself, if you really go into the detail, the science, why colds are commoner in colder weather, there is some evidence that says that when the weather is colder, the way the nose acts to protect us from infection doesn't happen really well. Which is why people may get cold more often. And then when you put someone who is already sneezing in a colder weather, you realize that that person will sneeze more and then their nose will run more. There are certain things in our environment that are irritating to us. Pollutants, let's say burning rubbish, strong scents, all those ones. There are some people whose bodies are made in such a way that the harsh scents cause them to sneeze and so on. So if you already have a cold and then you smell those things, it may make your symptoms worse. And if your environment has cigarette smoke and so on, they will all worsen whatever symptom that you are presenting with. But what I want to say is that it is not common cold. What we are calling common cold is caused by viruses. Okay. People may have a reaction to certain chemicals or pollutants in the environment, but we do not call that common cold. We call it something else. Okay. Although if you now have a common cold and you go into those environments, your symptoms may be more. Like colder weather, your symptoms may be more. But common cold itself is caused by a virus.
We'll take another question. Oh, studio audience. Okay, go on.
Thank you very much. It's been an insightful presentation. But my question is about the use of crystal menthol inhaler, which is usually dissolved in hot water. Is it recommended for children, for the use of children?
It is not. The one thing that is recommended is saline.
Saline.
The child's nose. If they have a fever, you give paracetamol.
Okay. Thank you very much.
All right. Thank you to our studio audience. Now we move back to the chat box to answer our final question. How do you help a child who is not able to cough out the phlegms?
We all have the ability to cough once we are living. So the child who is not able to cough, you see, I feel like this is a mom who thinks that there is more there than the child is coughing. So from that angle, perhaps if you give the child warm fluids, if you give saline nasal drops, that will help. I'm assuming the mom is coming from that angle. However, there are some diseases that weaken our muscles. So we have muscular dystrophies and so on. And those ones, because the muscle is weak, then they don't cough really well. And so for those ones, we have devices, cough assist and so on for them to use. But I feel this is just a mom who thinks there's more there than the child can cough. You can also try some honey, because one of the things honey is said to do is to like really breaks down the mucus very well, and then they are able to cough it out. But I don't think this mom should worry. Your child will cough when they need to cough, and it will all run its course.
All right, we have a few more questions. Looks like it's very interesting and many people want answers to their questions, so permit us to take them. I have a 13-month-old who has a cold, and it's been for over a month now. I've had her nebulized once, but it went down, and now she has a running nose again. Do I still do the saline nasal drops, or do I nebulize her again?
So again, this is something that parents don't report very well, I think, because they don't know that what they are reporting means to us, the health workers. Now, you have a parent whose child has had two cold episodes in a month. The cold started, say, on the 1st, and by the 10th or 9th, the child was completely well, nothing. And then let's say by 23rd, the child develops another cold. A lot of parents tend to say that the cold has lasted a month, when what they should say is that the cold got better or really went away, and then this is the second episode. Because now, if you tell me that a cold has lasted a month, I'm going to say definitely go to the hospital. But if you tell me that the cold resolved and there's another episode of cold, I'm going to tell you that this is probably nothing to worry about. If your child is eating and drinking, you can stay at home and just watch, and then just like the first one, it will resolve.
All right, so my 2-year-old has a cold and a cough, and now has cold sores on the lip. What does it mean?
It doesn't mean much. Cold sores, they flare up when we are stressed, and just having a cold is stress for the body. So it doesn't mean much. If you wait, it will resolve. It might be a little painful. If it's very dry, you can put some Vaseline or shea butter on it, not in the nose, and then it gets better.
All right, when children sleep under the fan or the air conditioner, does it cause them to develop cough and colds?
It depends. If this child is allergic to, say, house dust mite, which is found on our ceiling fans when they are very dirty and we don't clean them, or the AC has not been serviced for a year, so that AC that has not been serviced for a year is probably full of house dust mite. So if this child is allergic to house dust mite and sleeps in these conditions, the next day the child may, because they have an allergy, start experiencing a running nose. That is not common cold. A lot of people who have allergies may also have asthma. The child starts to cough, or just the running nose. When you have your nose is running, when it trickles to the back of your throat, you may cough a little, or just that, and then they cough. So again, if you find that anytime your child sleeps under a fan, they have a running nose and a cough, it is not the same as a common cold. But if you go to a doctor, then they take a detailed history, and then they can help with what this might be. Whether the child has allergies, allergic rhinitis, asthma, or whatever, and give you the needed help.
All right, no. So someone also says that my breast milk gushes out a lot, and this makes him choke and cough during feeds mostly. What do I do?
So one way, if your breast is full and you are not breastfeeding at that time, is that you can express it. Expressing just helps you to get more breast milk, and maybe you leave the milk if you are going somewhere. If anytime you take your breast out to feed your child, the milk gushes, your child chokes. The other aspect is that the child is probably also in a hurry to feed, and that happens when we don't pay attention to the child's or the baby's hunger cues. When they are, when they have been very hungry for long before the breast comes, then they do that and then they choke. So I think I would just say, watch your baby a bit more. Watch out for the hunger cues. They tend toward the breast. They tend to and those sort of things. And then you can feed at that time. If the breast is too full, you can express some before you put the baby to the breast so that the flow is much slower.
Someone is asking about the kind of saline you are talking about, the nasal drops. They want to know what kind.
So saline is over the counter, which means you don't need a prescription. So if you go to any drugstore, chemist, pharmacy, and you say you want saline nose drops or saline nasal drops, they will give it to you. You don't need a prescription. And there are many, many brands that are available. Yes, in some countries even, they will tell you to go home and just do it yourself.
All right. Now we will take the final comment. So someone says that wait it out. Just wait it out. These parents nowadays know even past the doctor. They will label you dumb if you tell them. The antibiotic misuse among parents is so alarming. Every case you see at the OPD has antibiotics. So their comment is just wait it out. Like you have said, if it's a common cold.
So I think, let me just add to that, that for us health professionals, it's very, very important that we do our counseling well. The short answer is wait it out. But for the parents, that may not suffice. If they don't know that this will last 10 days, then they wait it out. They don't know, are they to wait 1 year? If they don't know that when they should come back, if this happens, come back. If this happens, come back. Then they are not happy. So that usually tells the difference between a good practitioner and a just okay practitioner. The way you counsel the parents. If you don't, they leave your consulting room, they go to another place. And sometimes they don't even go. They just go and buy antibiotics. Because Ghana, if you go to shop, you say, I want augmentin, they will give it to you. Yeah. So the counseling is very important. Wait it out is the answer. But for the parents, we need to tell them a bit more.
All right. We've had a very engaging session. I'm sure the audience here will agree. And you at home too, watching on Facebook or YouTube Live, I'm sure you have also enjoyed the session. Now we'll take the final words from Dr. Seiram Wadui, who is a pediatric pulmonologist at the Korle Teaching Hospital right here. And you know that in the Korle Teaching Hospital, this is where you will have all the specialists, subspecialists, and qualified professionals to handle all your medical needs.
I think I've said so much. So I would just like to say thank you to everybody. And also to say what my boss has said, that we are doing very well in Korle. And it's a good thing that now we are putting ourselves out there with the webinars and media education and so on. So you can follow our socials so that you hear some of these things. Don't be afraid of coming to Korle. We do very well. It's unfortunate that out there it seems like only those who are seriously sick are here, but that's not the case. So you should come to Korle. We'll treat you very nicely. Thank you.
Thank you very much, Dr. Seiram Wadui, for joining us and for the knowledge that you have shared with us. Now, we would like to thank you very much to our studio audience. All right, so we have brought today's program to a close, or we are bringing it to a close now. We have been talking about common cold and cough. You have heard what it looks like, what you should do, what you shouldn't do, when to see your doctor, and not to misuse antibiotics. This webinar was proudly produced by the Public Relations Unit of the Korle Teaching Hospital. Definitely with the support of the management of the Korle Teaching Hospital. And today you had Dr. Sarah Mwadwi and myself, Dr. Hilda Boy, from the Department of Child Health here in this hospital on this show. Now, until we see you next time, thank you and stay safe. Bye.